Good morning, everyone. I am so excited about welcoming you all to Coffee with Kay this morning, where we're going to have a conversation, not a presentation. My guest this morning is Dr. Danielle Lane, CEO and
Medical director.
medical director of the Lane Fertility Institute in San Diego, California. Dr. Lane has an amazing outreach to the public, in addition to being a fantastic physician. And she's going to tell us a little bit about how she does it, why she does it, and why it's important for you. Dr. Lane, thanks for coming on.
Thank you so much for having me. And I have to say, I've said this to you before, I'll say it again. I am humbled to be here with you. I think the work that you do, just makes me, want to work harder every day for patients because access is so important to me. And you were a trailblazer in providing that. So thank you.
Oh, you just
You were.
melt my whole heart this morning. You melted. It's all melted all over the place. So thank you.
No,
So right into it. For those of you, I'm sure most of you have already seen her. But for those of you who have not, you need to follow Danielle Lane on TikTok. Her videos are fantastic. So let's jump right in. How do you do it? Why do you do it? Tell me about this phenomenon of your TikTok presence, because that's exactly what it is.
That's so funny. I can't even fathom that. But all right, here's how it started. So we were hanging out in during quarantine, and I have 5 kids, 4 of whom are teenagers, who were dancing at their phones, and I was trying to figure out what they were doing. And I as a parent, I half wanted to make sure that the platform that they were on was like a platform that they should be on, right? And then I was like, but why are you dancing at your phone? Like, I don't understand why you're dancing at your phone. So, they introduced me to the platform and I started to look around and I noticed that there were some doctors on the platform. And I thought, well, that's interesting. And then I drilled down further and I was like, well, wait, there are actually some fertility doctors that are on this platform. Well, that's interesting. What are they talking about on this platform? And I figured, okay, well, I guess I can sort of dance. Like, I'm not great at it, but I can pick up some footwork and move a little bit. And,
Okay, let me just say, you have all the moves. I'm jealous. Okay.
Well, let me tell you the feedback. Thank you, because the initial feedback from my kids was, "You look ridiculous, Mom." Right? So, anyway, not to let anything like that stop me. I was like, "Let's give this a whirl." So I tried it, and I noticed that that people seemed to be interested. Right? I think the second one I did was just about like who I was and what I did. I had a practice and some kids, and people were like really interested in that. I thought, well, that's interesting. What's so interesting about that, right? Because of course it's your life. You don't think your life is that interesting. So I started to think, okay, well, what topics can I talk about that other people haven't already talked about? And then I realized that the folks that were following me were different than the folks that were following other providers.
Yeah.
That there was no other, and really, I think there's one other African American fertility specialist on the platform, and the only other one that's on there doesn't really. It's not her. It's not her primary platform, so she hasn't really made that a space for folks to really get information in the same way. So I thought, well, that's interesting. And then folks started to reach out to me. And of course, around that time, I opened up my Instagram. And so everything that's on my TikTok, really, I just copy it onto my Instagram 24 hours in the day, right?
Yes.
And people started to ask questions and engage. And what was interesting is that the questions were really basic questions with very, with information and knowledge that we sort of assume that people know. And I realized that there's this huge gap of what a physician assumes a patient knows and what a patient really knows, right? So what a learning experience that was for me, and I think the other thing that became very clear to me is that there were groups of people who felt as though they were able to get access to care, and there were groups of people excuse me, who felt as though they were not getting any access to care. And so I wanted to see how I could make those people feel more comfortable to advocate for themselves as patients. And that was people saying, gosh, I've been to a provider and I don't know what to do now. And I'm thinking, well, ask them what their plan is, right? Or gosh, I don't know how to get to an REI or a fertility provider because my OBGYN won't send me. And I'm like, but why do you need to be sent? Just go. So those sorts of conversations started to happen again and again and again, or folks that were saying, I've been doing the same thing for months and months and months and no one's reaching out to me. And I was like, well, then you reach out to them, you know? I think it became clear to me that there was just this group of people that were not getting care and that were willing to get care, willing to try and make it work, willing to pay, maybe even had resources to pay for care and didn't feel like anyone was listening to them. That was really upsetting me.
I wanna kind of break that down a little bit. Gave me a whole meal, and let's go through the different courses because what is just so powerful. First of all, I know that there have been those providers who have said it's not dignified doing outreach on social media. And I've personally even gotten a little bit of pushback, like, why do you do this? And I know my reasons are similar to yours because people need the information.
Yeah.
And if it's easier for them to watch me do a busset challenge and throw some information up there,
that's right.
More likely to get the information by watching, thinking they're going to get a little bit of rump shaking, even though they don't. But
right, exactly. Because we're 50. Okay, I'm just okay.
But they're more likely to watch it and then get the information because they think this is something that I can relate to than if I just threw up a PowerPoint slide, with references. Then I'm going to go ahead and give them the information because they need the information. So tell me a little bit about what you would say to that.
I think that there's enough evidence out there that the way in which we have delivered fertility care has been inadequate and inequitable over time, that I don't know that until folks show me that they are able to do a better job of approaching the entire population, I don't know that they get to criticize how we get there, right? I just don't think that, for me, that's a valid complaint. They can make the complaint, but it doesn't change my need to make sure that people feel as though they're worthy of the care. I mean, the stories are pretty striking. I had a patient who came to me who had several terminations before she got to the point where she found a second partner and wanted to have fertility care. And the reason she had several terminations is because she was in an abusive relationship and she was trying to get out, right? But the provider that she saw didn't ask those questions. They just saw a person that met a certain profile, and they felt like that person wasn't worthy of fertility care because of whatever had happened in their past. So here's this patient coming to you,
unworthy of care.
Right. Do you know what I mean? And he didn't say those words. He or she, I don't even know whether it was a boy or a girl, doesn't matter. They just didn't give them an option for care, right? They didn't follow up with them. They didn't give them a path to whatever, Clomid, IVF, pick your, yeah. They just, right? And this was in a state that has mandated care. So it's not even like the patient had to come up with money to do the cycle. They just needed access to a provider that was willing to provide the care. And so I think that it's interesting to me because it's, again, one of these scenarios where I think that if people really stopped and thought about it, they would want to provide care to all these other populations, because at the end of the day, there's a financial aspect to fertility that, is real. Okay. I mean, this is a multi-billion-dollar industry around the world, right? And so the venture capitalists aren't in our field because they care so much about medicine. They're in our field because they know they can make money off of our field, right? But the reality is, folks are just they're not even taking the time to think about these patients that want care, and that want to have kids and grow their families. And I find that shocking, although maybe not in our current climate. I shouldn't be so surprised, right? And so I was thinking about this the other day, and here we are talking about the increased maternal mortality threefold higher in women of color, right? And now we're also seeing, there was a really nice article that Michael Thomas, who's an REI out of University of Cincinnati. Yeah.
Yes, we gave him one of our family building champion awards at the gala last year.
Yes.
President of the American Society of reproductive medicine, first African American. Just give a shout out to
Ever, right? Ever. Like, that's amazing, right? And so his article basically highlighted the fact that, there was this gap in care for women of color. And, we're not just talking about African Americans, we're talking about Hispanics, we're talking about, really anybody who doesn't identify as a middle or upper class Caucasian patient. I mean, that's really what we're talking about, right? And he was saying that there's this gap in care for them to get fertility care. So we're not helping people get fertility care. And then when they get pregnant, we're having a hard time getting them through pregnancy. I mean, this is really fundamentally a problem for our culture and our society, So I think
this issue. It's not just care, quality of care.
no,
It's
no, it's actually access to care.
Yeah.
So, I think that until we sort of acknowledge that, we are not doing our jobs as fertility providers. You know what I mean? We're just not. Separately, but equally as important, is cost and cost issues. And that impacts everybody, right? I mean, I'm sitting here, so I'm actually in San Francisco, not San Diego, but here in the Bay Area, the reason that comes up is because, there are a handful of tech companies that blessedly have offered their patients benefits. And that is amazing, right? I mean, you can work for Google or Facebook or Netflix or, Tesla, and you can get just oodles, I mean, tens of thousands of dollars of care, $50,000, $125,000 of care for fertility services. Great. But if you're not in that narrow band of people that applies to, if you make more than that, okay, fine, you probably can write a check. But if you make less than that, which is a lot of people in the Bay Area, you just can't access care. And even in the mandated states, like if you are not somebody who has insurance for whatever reason, right, you can't access care. And I think, for it to cost $10,000 or $15,000 to have a baby is a lot for people. We just did a survey. I did it at the beginning of the year with a team of people to look at 21 to 50-year-old folks across the country and to ask the question, if fertility care was more accessible, meaning cost-wise, would you consider expanding your family? And 23% of Americans that were in that age range said, yeah, of course we would, but we just can't get there, right? And it was particularly telling in women, it was higher percentages in women and couples who made less than $100,000 and in African Americans, right? So not only is there not the access, but there isn't the affordability, and all of that, to get back to your initial question, is why I keep coming back to TikTok. Because if I can tell one person about compassionate care, or one person about the Cade Foundation, or one person, about InvaCell as opposed to IVF, one person, then, that person will tell other people, and then maybe we start to get the message out so that folks can have their families.
Those butterflies, the butterflies.
Yeah. It's right? I mean, I hope,
Yeah, yes, absolutely. I love it. You know what? We are out of time, but I'll tell you what, I could keep talking forever, but I want to make sure that, like we talked about, the information gets to the people who need
I hear
it,
you.
which means Instagram cuts us off after 15 minutes. So we want to make sure that we condense it so that they can follow up for additional information from you. So if you're in the Bay Area, set up an appointment. Dr. Lane, your practice is open.
It is. And if you're not in the Bay Area, we do telehealth, we do consultations, even if it's just to help you feel confident enough about the information that you've heard that you can go back to your doctor that's local and get more care.
So thank you so much, Dr. Lane. If you'll hold the line, I'm going to log us off, but I appreciate you. For everyone else, this is Camille Hammond with the Cade Foundation. And if you have a financial need for support, we do have family building grants, which will provide up to $10,000 for fertility treatment or adoption. And those grants are not limited to anyone from any particular state. We don't exclude based on anything other than a diagnosis of infertility. Before we log off, this is Coffee with Cade. So I have to ask Dr. Lane, what's in your cup?
Mine is just tea. I'm having tea this morning, Earl Grey.
I love it. And I've had 4 glasses of Earl Grey already. So I am like on fire.
There you go.
Right now, I just have hot water with lemon. But thanks for joining us. We'll see you